This is a quick overview of the PrognoCIS Dermatology demo database. The appointment schedule is extremely flexible. You can view appointments by week, by day, or if you have multiple providers, you can see their schedules side by side. All of the little colored blocks that you see here are appointments, and different appointment types can have different lengths of time, different colors. You can also control your schedule template, what is available on the patient portal for people to schedule, as well as what types of visits are available in each of those slots based on location, time, as well as the encounter types that you want to put in those slots. To schedule an appointment is super simple. You just double click the appointment time. You can choose from a patient that's already on the list, or you can click this button, which is called our quick register, and that gives you the ability to put in just a few details about the patient, pop them on the schedule without having to get all of their details. When you're ready to schedule the visit, you can pick which type of visit the patient is coming in for. This list of your visit types is also customizable. You can add a reason for the visit here. This is also a list of the complaints in the HPI section, so you can attach it to a complaint. There is a waitlist functionality, also a search feature that gives you the ability to find certain days of the week, location, provider. This finds the next available appointment instead of surfing through the schedule. When you're ready to schedule the patient, you just hit the schedule button. We have a full patient register where you can add the patient's demographics, insurance information, automatically verify insurance eligibility. We have lots of additional fields such as the emergency contact details, employer if that's applicable, other physicians that are treating the patients. This is the billing info tab for the front desk, so you can see the patient's previous balance. You can also collect a copay and document that within the system. Back on the home screen, this is the home screen for the providers and any clinical staff. And this gives you a flexible ability to see multiple providers within your facility, specific visit types. This filter is based on the individual user who's logged in. And also move around the different columns that you're seeing on the screen. There are lots of different options for adding and removing columns. So that dictates the order of what shows up in the screen. You can also adjust them by size and sort them by each of the categories. Here we have a row of patient forms. We have a patient portal, and you can ask patients to complete information on the patient portal, as well as on what we call Pro Check-in, which is a tablet-based system. You provide your own tablets, and we give you a URL where you're able to have patients complete forms, or you can have your staff come in here and complete forms. We customize these forms specifically for the practice, so we have some general forms that are in our library that you can review and add additional things, or you can give us your own forms and we can make them look just like a paper form. When the staff has reviewed this information and accepted it, it populates into that visit. We do have integrated telemedicine, so if this was a telemedicine visit, we'd have a little camera icon here within this column. When the patient arrives for a telemedicine visit, the provider gets a pop-up. We can also send you a text message letting you know that a patient has arrived for their visit, and it also includes a little count of how long the patient has been waiting. To initiate that visit, you just click on the camera, it takes you into the visit, and then you're able to review the patient's chart before the patient is arrived into the visit. You're able to accept the patient into the visit when you're ready to see them face to face. Here we have our reason for visit. If we added that within the schedule screen, we have our different visit types here. This visit status column gives you the ability to see where the patient is within the visit. So are they with your clinical staff? Are they with you as the provider? Are they ready for checkout or finished? You can load your room numbers in there if that's applicable. And then you also have the ability to see in this process status if there were any orders within these visits, lab, radiology, it would indicate that there is something that needs to be completed. And then we have comments that are kind of internal comments between the staff members that you can only see within this screen and not within the patient's chart. So when you are ready to actually document a visit, you just click the patient's name and it takes you to what we call our face sheet. And these face sheets are very flexible. Each user can move things around, resize certain screens. These details such as your history information, your surgical histories, past medical history, allergies, medications, can be completed by the patient on those patient forms that I showed you back from the home screen. Again, those are available on the patient portal as well as ProCheck-In, tablet-based system, and then you can also have your staff complete those. You can determine if you want additional things in the screen, such as personal notes. We can also pull in things like your vitals, visit over visit. You can also see lab results and things like that within the screen. So this gets set up for you can have up to 9 different face sheets, and based on the type of visit that you are seeing, a different face sheet can appear within the screen for you. And then you can choose from the additional face sheets by a drop down. So from here, I'm just going to go into a SOAP note format. So typically my staff might have logged some vitals for me. If I've had multiple visits, I would be able to see those visits side by side. You can again view this information on your face sheet. So if your staff completes that for you, you don't have to go to the screen. You can just view it there and then start with your subjective portion of your SOAP note. So this is our complaint screen, the same list of complaints that we saw from our scheduling screen. If you'd like to load ICD codes, as you choose these complaints, it will automatically put those ICD codes in the assessment for you. From here, we can document different types of elements. These elements are super easy to edit, so you can actually double click the element itself, see the list of the different drop down choices, pick a different type of field. So set of values is a drop down like this. Multi-select would give you the ability to select multiple. Super simple to edit those. This is what goes into the actual progress note. So if you have kind of a wonky sentence, you can come in here and edit that really easily. Make sure that it is, looks really good in your progress note. You can have the staff fill this section out. You can fill the section out. You can also copy this information from previous visit. There's a copy button. And then you also have the notes section at the bottom of each complaint. So you'll see we have a lot fewer elements in the acne section than we do in the contact dermatitis. You can add your notes here. So if you choose not to use the drop downs and the pop-ups, you can just type notes here. You can also put behind all of these little binoculars some statements. So if there are certain things that you want to be able to put up to 1,000 characters that add in this area for you quickly, you can save those in those binoculars. And each of these also have binoculars where you can save commonly chosen options. These little green workflow arrows will basically take you from screen to screen. They do kind of a save and next function. We also do have auto save that you can turn on, so you never have to hit the save button. We, in our physical examination section, have multiple different types of physical examination templates. So you can have a full physical examination with all of the different organ systems, or if you want to have a really specific skin physical examination, you can even break this into multiple sections if you want to. So very flexible to set this up. I'm going to open this little third window over here and show you your progress note. Incidentally, this is also where we would have our video visit. So if this was a telemedicine visit, I could open this section and talk to the patient in this little window over here. I can even pop that open and move it to another window, share my screen. A lot of the functionality that you see in like a Zoom telemedicine or Zoom meeting. From here, to document a fully normal physical, I just check this box right here and save, and it will update my progress note. And it looks like I've attached some pictures, which can also be done. It's going to update my progress note to add in the elements that I've completed. If I go back and I choose a different physical examination template, add in some organ systems there, you're also going to see all of those elements. So it adds everything in there. If you didn't examine some of the systems, you could just uncheck those or uncheck all of those. When you save, it will update that for you. I've got to scroll back down below the pictures. And so if there's anything abnormal, it will show in red. So when I update and show that, I will have my additional items in red in this section. From here, I can go to my assessment and plan, and I can start to document what my assessment, my plan are for each of the different diagnosis codes. So these diagnosis codes appeared here because that's what I have attached in my HBI template. I can come in here and add a separate plan for each of those. I can load some plan information behind my little binocular here. So if there are things that I say very regularly, I can add those in there and I can save those. I can do, again, a different one for each of these. There's also educational materials loaded in the system automatically by Medline Plus and Merck Manual. And so you can send these to the patient via portal, print, or email. From here, I can launch my prescription screen, and also if you'd like to maneuver along this left-hand menu instead of through the little green arrows, you can also do that. So there are about 30 options that can go in this left menu in your specific order for each visit type. So depending on the different ways that you like to maneuver through the system, we give you about 3 choices for everything. So part of the implementation and training process is kind of walking you through all the steps and then setting it up based on your preferences. So here I have my previous prescriptions that this patient has been prescribed, so I can check this little +RX button to refill those, which is what I've done. I can set the patient's preferred pharmacy. I could also have set that in my demographic screen, so that can be done by the front desk. When I am ready to prescribe a medication, I just confirm everything. Any kind of alerts in terms of medications being inactive or there being interactions with their medication list, that will pop up here. When I'm ready to prescribe this medication, I just hit the ERX button. We also do have electronic prior authorizations that are available electronically within the system. So if a prior authorization is required, it will give you a pop-up and let you know that. The patient's eligibility, if it's available from the pharmacy benefit manager, will also appear in the screen, so you'll see what their copay, coinsurance, so on and so forth will be based on that particular patient's benefits. We also have full order sheet functionality, so if you need to order lab tests, radiology, consults, which would be kind of referrals out, and then procedures can be in-house procedures or procedures that you're referring out. You can order all of those from this screen, and the nice thing is when you put those orders in, it'll show on the face sheet for your staff to see on the process section, and then it will also show within your progress notes. So you don't have to order it and then say in your plan that you're going to order it. When you are finished with your documentation, you can review your progress note, see everything that has been added into your progress note. We have a lot of flexibility and functionality here. You can choose whether you want to add pictures. We do have a pictures section here into the progress note. You can even add lab results, those sorts of things. So we can pull a lot of different things within the progress note to give you the ability to have that directly within this screen. And when you're finished with your encounter, you go to the encounter close screen. This screen can be configured so that if there is, for example, a procedure in this visit, which I'm going to show in just a sec, that if you have to have specific ICD codes to go with the CPT codes that are in the assessment, then it can give you a pop-up. So we have kind of claim scrubbers on the clinical side of things. You could also hold the visit open if you didn't do parts of your documentation, or if you have some maybe medications that have been prescribed but not yet sent. If you are ready to finish your visit, you can check this button to create the claim and leave the visit open, or you can mark the encounter closed and save, and it will mark your encounter closed. I'm actually going to reopen that and go to our procedure section. So that's kind of the visit flow for a progress note or SOAP note visit where you're doing a consult. If you're doing a procedure, we do also have a procedure section where you can customize your own template for the different procedures that you do in the office. And we have a library of hundreds of different types of procedures, administration of medications, cryosurgery, excisions, biopsies, lots of different options. And again, we do customize those for you. So here's just a few kind of different options. A laceration repair, which is kind of simple. A biopsy, which is also pretty simple. You can make these as simple or as complex as you want to. You can also attach your CPT codes so that as you document your procedures, they automatically add to your assessment for you. And when you document one of these procedures, what I recommend doing is kind of putting your normal answer at the top of the list. So all you have to do is very similar to your physical, check this box, hit save, make any changes for things that were unusual for that type of visit. And then if you hit the preview button, you'll see a little narrative note. And again, this can look exactly the way that you want it to, have your signature at the bottom when the encounter is closed, and so on and so forth. Each of these documents create a separate document within the document list. So we have all of our different procedure forms as well as our progress note for today. So this document list, think of it as kind of your paper chart. As you document things in PrognoCIS, as you scan and attach things, all of that gets saved into your document list. You can search for keywords within there. This is also where your lab orders, your radiology results will go. If you send messages to or from staff members as well as patients on the patient portal, those will go in here. Letters Out is a faxing and emailing screen, so you can actually have a screen to be able to send outgoing faxes as well as emails. So any other individuals that are listed in the patient's chart, for instance, their primary care provider, if they're attached, you could click this little button, hit go, so you can save those numbers in there. You can have lots of different form letters that you can send to individuals. You can even edit it directly within the screen. When you're ready to send one, print one, or fax one, you just save it. As long as you have the individual within this section, you can hit this button to fax, this button to email, and we do have secure and unsecured email, and then you can also print it. We also have a referring provider portal as well as a patient portal. It looks like I don't have them on this database, and so you could send this directly to the patient as well as the referring provider directly from this screen as well. When you create something in this area, it also shares into the patient's document list. So back on my document list, I can see any letters out that were created for that particular patient. We also have several other areas. I mentioned pictures. We also have dictate and transcribe. So if you prefer to dictate all of your progress notes, this is essentially a summary of all of the note sections for all the screens that I showed. So you could come in here, you could dictate it with the Dragon device or on a cell phone on Siri or an iPad. And then we also have the little phrases section here as well. So if there are things that you wanted to, pick from multiple choices, you can do that. You can also automate a lot of the items. So based on your HPI complaints, you can have your plan automatically flow into the assessment. So if you have some things that are kind of standardized, you can attach those items together and automate that for you. So it really gives you the ability, if you spend the time setting it up, to automate a lot of your workflows and a lot of your documentation to make your time a lot quicker. I mentioned faxes going out. We also have the ability to have faxes come in. So we have an attached center. You can also do individually scans directly to the system, as well as if you scan something to like your laptop, you're able to attach it to a patient's chart. You can also have a list of faxes that come into the system and have a staff member who will go into those faxes, review those, pick which type of document, what patient it needs to go to, and attach those to the patient's chart. So that is a brief overview of PrognoCIS Dermatology. We're just scratching the surface of all of the lots of great features that we have available. So hope you schedule a demo today. Thanks. Bye.